Hi there, welcome to IPM News on Monday sometime. My name is Rulurala in Georgia. There is a highlight news today. People are still using only Tylenol over ibuprofen. Out there, our pharmacist reporter will find out the truth for us. Are you still there, a pharmacist?
Thank you, Rulurala. Hi, I am a pharmacist reporter here. It is the Corona era and staying home era. Now in Georgia, the doors has opened since the May the 1st for some businesses, but it seems like nothing has been changed in reality. We are still stuck at home. Previously, I had hoped that near summertime, this condition would get better soon and I'm gonna come back with my regular routine, but now we are even worrying about the new wave. Today's news mentioned that China had a new outbreak in Northeast. In Korea, they are already preparing for upcoming new wave, possibly in June. It seems like it will never end. I have seen a lot of people using only Tylenol over ibuprofen because of the debate that ibuprofen can make COVID-19 patients worse. Really? Do you believe so? Do you think it's true? So today, I'm going to discuss whether it is true or not true and some facts about Tylenol versus ibuprofen. Does ibuprofen make COVID-19 worse? Nope, I will tell you the answer up front. The answer is no. There is no evidence that ibuprofen or other non-steroidal inflammatory drugs can make COVID-19 cases more severe. Many articles have written whether ibuprofen or NSAIDs such as naproxen or prescription medicine Celebrex can worsen COVID-19, a disease caused by novel coronavirus. How did this debate start? It has started with the comments from Dr. Olivier on March 14 that taking anti-inflammatory drugs such as ibuprofen could be a factor in worsening the infection. He advised people with fevers taking Tylenol instead. Also, a few days earlier, British medical journal The Lancet Respiratory Medicine hypothesized that ibuprofen can make it easier for new coronavirus to enter cells. Soon after, inaccurate information was coming up here and there, supporting ibuprofen can make it worse on COVID-19 patients. What kind of inaccurate info? One of it was from Vienna, which mentioned vast majority of people who died from COVID-19 had taken ibuprofen. Second of it was from Vancouver Hospital. A nurse said Advil makes the symptom 10 times worse and it made kickstarts into the pneumonia. Both were fake news. What did WHO say? On March 18, 2020, WHO took back the warning that they informed earlier, which they endorsed the recommendation to avoid ibuprofen. But now they said, let's hear what they say. What's the mechanism behind? NSAIDs relieving pain and reduce fever by blocking COX. COX blocks prostaglandins, which will reduce inflammation. But by blocking COX, it also means it can lower the effectiveness of the immune system, immune response. But the weird thing is, if that's the case, Tylenol is not a good choice either, because it also blocks COX, which will block the prostaglandins to a lesser extent than NSAID, but it still does. So Tylenol is not a good choice either. The other hypothesis is that ibuprofen raises the level protein called ACE2, ACE number 2, which the novel coronavirus is used to enter the human cells. This can be concerned with hypertension and diabetes patients because these patients can take ARB or ACE inhibitors, which will increase ACE number 2 level. As a result, it facilitates infection and increases the risk of developing severe and fatal COVID-19. But there is no evidence that ibuprofen raises the ACE2 levels. It's just a hypothesis. Conclusion. Currently, no strong evidence, but possibility still exists. So really nothing is matter with ibuprofen? Even if there's no strong evidence with ibuprofen with COVID-19, there are good reasons to avoid NSAIDs anyway, because of patients' pre-existing conditions, or very ill, or elderly patients. NSAIDs have previously known side effects, such as gastrointestinal, kidney, and cardiovascular side effects. But that's nothing to do with COVID-19, but just the way NSAID works. Since there is possibility, should I only take Tylenol anyways? Yes, you can. But there's one thing that's important, is their difference. Acetaminophen is only effective in fever and pain, but ibuprofen relieves inflammation in addition to pain and fever. Ibuprofen is more effective for strains or sprains or swelling on your throat. So when you have a symptom related to inflammation, ibuprofen would be the better choice. Acetaminophen doesn't work. I hope this video clip answered you enough for your curiosity regarding acetaminophen versus ibuprofen over COVID-19. My next video clip will be the recommendation on the medicine what you need to prepare for coronavirus era. Let's use the medicine accordingly and consult with your physician as well. So I'll see you soon.